My name is Oscar Loynaz. I am proud to be the president of Miami Dade College's Padron Campus, and I am happy to say that I am a cancer survivor. I was diagnosed with prostate cancer, and I'm currently cancer-free. So I have been monitored for prostate cancer for about 6 years. There's a simple blood test, which is called a PSA, that lets you know your level of risk for prostate cancer. And we have been monitoring that with my urologist for several years now. And finally, in March of 2024, I was informed that as a result of an MRI and a biopsy, that it was time to have surgery and have the cancer removed. And so we went ahead and did that. Yeah, I have a history of cancer in my family. My mom had breast cancer twice. My father died of esophageal cancer, which metastasized to the lungs. My grandmother had bladder cancer. So cancer is something that is not a stranger in our family. So I'm a strong believer in prevention. And so I've often thought that that is the best way to deal with anything such as cancer. So specifically for prostate, I did not know anyone in my family that had it. I did not know anyone in my circle of friends that had it. So it was relatively new in terms of a personal experience. But I had been just monitoring it as a result of my age, my blood tests, and it's something that a lot of men my age have to really keep in mind because it is not uncommon. Prostate cancer is something that many people, many males, are diagnosed with, and it's just how you treat it and how you manage it that makes the difference. Don't. I think it's really important that people know their health status. Even, for example, when you talk about stigma, one of the most common cancers for young men is testicular cancer. And a lot of people don't want to talk about that. Just like, early breast cancer detection in young women. These are very personal topics that people don't necessarily like to talk about. But if you avoid it, it could be the difference between life and death, right? So I think anybody that is alive should get regular checkups, should really pay attention to anything different that happens in their bodies, anything that they're feeling different, and not be afraid to explore it. The easier, not the easier, but the earlier that you find out, the easier it will be for you to treat it and for you to manage it. In my case, we caught the cancer pretty early on. So the surgery was all that I had to do. I didn't have to do chemo afterwards. I didn't have to do anything like that, knock on wood. And I'm still being monitored for that. But I do believe that the earlier that you take care of a problem, not just cancer, but any health problem, the easier it will be for you to recover and the healthier and happier you'll be as an outcome of that. Taken care of. But when people hear that word cancer, it really impacts you. People kind of take a step back. And that's actually one of the things that I've been struggling with, which is that my process has been relatively simple. And if you compare it to other people, and I compare myself to others, and I realize how fortunate I've been that my process hasn't been as complicated as others. I have people close to me that are going through some cancer issues right now, and they're struggling, and they're having hard times making it through the day, and they're having lots of problems that are associated with it. And to me, being able to just, you know, have gone through this and be where I am today makes me feel fortunate, and at the same time, um, like really kind of it's a feeling that I can't explain, where I'm sort of like, well, why me? Why am I here to be able to talk about it, and why am I here and not suffering like others? And I only wish that I could take the pain that others have, because it's hard to watch some people suffer sometimes. So. Yeah, interestingly enough, I have a colleague that's going through exactly the same thing right now. He actually had surgery last week. And my words of advice are take good care of yourself. Sometimes we're in such a hurry to get back to work or in such a hurry to get back to normal. Things take time. It takes time to heal. It takes time to heal mentally, emotionally, physically. And so don't rush it. Um, Take your time with the recovery. Embrace every day like a new opportunity to feel better. Um, but remember that you are the most important thing. Of course, our families are important. Other things are important, right? But if we're not here, what can we do for them? So I think it's really important that we recognize that and take good care of ourselves and not try to jump to be something that you're not ready to be at that time. Such as what we're doing right now. People telling their stories, making awareness and the reality that it can happen to anyone, right? And it's not just cancer, it's also, heart disease. It's so many things, right? Mental health, which is huge. So there's a lot of things that we at this institution and others around the country and the world should be doing to raise awareness because you all are starting your lives. I mean, you've been living for quite a while, but you're starting your lives now as young adults, and how you care for yourselves and how you embrace life will make a huge difference in the quality of your life 30, 40 years from now. So I think educating individuals, raising awareness like we're doing, um, letting people know it's not, there's no stigma, there's no fear. Just get regular checkups, make sure that you have a qualified physician, nurse practitioner, PA, whatever, whoever it is that you're being seen by. If you're not comfortable with a healthcare practitioner, go to somebody else. Our relationship with those that take care of us are very special relationships, and you should always be with someone that makes you feel valued, that listens to your concerns, and that elevates you rather than dismisses you.